And if a veteran is pursuing service connection for auditory processing, whether primary or secondary, what types of medical evidence would be the most persuasive? I know it can be really tough when there's a rule out, like hearing loss. You need to
get past that.
Right.
Yeah, well, an audiologist would sort of be the baseline. I think you are going to have trouble persuading the VA of a freestanding audiological processing disorder without pretty compelling evidence from a neurologist, I think, before you get to the end of the road there. That's not to say an audiologist might not be able to convince the VA, but this is a kind of condition that VA can't see, touch, smell. Anytime you get into the realm of things that the VA rater can't kind of see and touch, it's a challenge. So the better medical evidence you can put together describing what's going on, showing why it's going on, showing how it's related to your service, the better you're going to do. It's just conditions like this are challenging to prove.
I know that with hearing loss, simple hearing loss, family statements, lay statements can be very helpful in getting an accurate rating. Would the same be true in a case of?
Oh yes.
Okay.
The more evidence you can demonstrate, you can provide about how this interferes with someone's functioning, the better. And who better but immediate family to provide
Sure.
that.
Welcome to the Victory Over VA podcast, a podcast about empowering veterans to overcome denied disability claims. Each week, we deliver critical insights to help you understand the disability process, veterans' benefits, and how to take control of your legal rights. Now here's your host, Attorney Francis Jackson.
Welcome to Victory Over VA. If you're a veteran struggling with the VA's disability system, or just want to make sure you're getting the benefits you've earned, you are in the right place. Don't forget to hit subscribe so that you never miss an update that could change your life. I'm Christian Terrison, here with renowned veterans disability attorney Francis Jackson of Jackson and MacNichol. Jack has dedicated his career to helping veterans like you win the benefits you deserve, recovering millions of dollars for thousands of heroes. This podcast isn't just for veterans navigating the system, though. It's for their families, their friends, and anyone else who wants to stand shoulder to shoulder with those who've served. So stick around, because we're here to make sure you get the support you need. Today, we're going to be talking about auditory processing disorders, veterans who are diagnosed with them, what they can do as far as disability claims and compensation. So what is an auditory processing disorder, and how does it differ from, simple hearing loss, for instance?
Sure. Well, in hearing loss, there's a mechanical failure somewhere in the system that transmits sound to the nerves to the brain. In auditory processing disorder, people hear things just fine. There's no problem there. The problem comes in that the brain isn't able to unscramble the signals from the nerves and understand what's being said. And it shows up in a couple of different ways. Psychologists, when they do neuropsychological testing, test, among other things, something called processing speed. And that's the speed at which the brain can go from having the ear hear the sound to having the brain interpret it to being able to understand it and cognitively work with it. So, for example, in the courtroom context, you've probably seen lawyers on television where someone makes an objection, and what's going on is the lawyer's hearing the objectionable question, he's sending that to the brain is processing it and saying, hey, wait a minute, there's something wrong with that question, we should object, and he's responding with stating an objection to the court. That's the auditory process loop. But when there's an auditory processing disorder, the ear gets the sound, but the brain doesn't comprehend either what was said or how to put it in context and respond to it.
Okay. In your view, do you think, most VA examiners understand the difference, or disability reviewers, for instance?
No. Auditory processing disorder is rare, and it's also a condition that is poorly diagnosed. 99% of the time, auditory processing disorder gets treated as though it was a hearing loss issue, because it takes some fairly sophisticated testing usually to figure out that it's not a hearing issue, it's a processing issue. Short of neuropsychological testing, that's not usually obvious.
Okay. So you said that it's relatively rare. What are some of the causes? Because if we're looking at service connection, it can't just be a congenital.
Sure. Yeah, and you've beaten me to the punch. What I was going to say is that for a lot of people with auditory processing disorder, it is a congenital condition. They were born with it. There's apparently some genetic factor. It can be inherited in families. But in the context of veterans' benefits, obviously, most people with a severe auditory processing disorder would get screened out before they ever got in the military.
Sure.
So it's most common for veterans to encounter it in the context of TBI or some kind of neurological disease, injury, whatever. That's in the veterans context where it crops up the most.
Now, can it be connected to exposure to noise in service the way that the mechanical hearing loss is?
I'm not an expert neurologist, but I understand that there are circumstances where particularly sudden loud noise can cause auditory processing damage.
Wow. So it's not only blowing out your eardrums, it's scrambling your brain too.
Apparently, if it's bad enough, that can happen.
Wow. Wow. I never would have guessed. I haven't seen any cases across my desk with anything that severe. So you've got the TBI as an aggravating or causal factor, but so when looking for service connection, is it looking back to either extraordinarily loud noise or TBI to get that service connection?
Yeah, most of the time it's going to be some kind of a head injury.
I imagine like a concussive blast, things.
Yeah. Or, the classic head injury, motorcycle accident, car accident, whatever. There are all kinds of things that cause TBIs. Being exposed to an improvised explosive device in Iraq, for example, will do it nicely, thank you. But, it is almost always in the VA context involved with some kind of head injury.
So for a veteran who suspects that they might have an auditory processing disorder, what should their next steps be? Because I imagine there's probably going to be a diagnosis for a hearing loss, but you mentioned the relatively advanced neuropsych testing. Would it be going to a neurological provider or?
Well, first, 99% of the time, you've got to rule out hearing loss first. So you sort of have to start there. So an audiologist kind of would be the place to start. If the typical hearing loss treatments, such as sound amplification or hearing aids, don't seem to help, then you probably need to move on to look at whether there's a processing issue. And one of the things that is likely to be a clue is when people can figure out what's being said, but it takes them some time. There's sort of a delay between you say something and they respond. That's more likely to be a processing issue than a hearing issue. If it's a hearing issue, they just won't understand you at all. There won't be a delay. They just won't get it. But if it's a processing issue, there's likely to be a delay, and that may be kind of the first clue that this is about processing rather than hearing.
So do auditory processing disorders get their own rating code?
No.
Okay. So are they rated under the hearing loss criteria?
They're typically rated under the neurological or even as part of a mental health issue, depending on what's going on.
Okay. Now, for a veteran who maybe has TBI and then that leads to an auditory processing disorder, if the auditory processing disorder itself is leading to further complications, I'm thinking, depression from social isolation, things like that, is it possible to service connect the depression in that scenario?
Sure. Yeah,
Okay.
that would be secondarily connected. But keep in mind that most of the time, when the VA is rating an auditory processing disorder, it's going to be rating it as part of some kind of neurological issue, whether it's a neurological condition directly or whether it's a TBI that's causing neurological problems, auditory processing and whatever else. I have not personally seen a case for a freestanding auditory processing problem being service-connected and rated. It's always been as part of some other kind of condition, typically neurological or TBI.
Okay. And if a veteran is pursuing service connection for auditory processing, whether primary or secondary, what types of medical evidence would be the most persuasive? I know it can be really tough when there's a rule out like hearing loss. You need to
get past that.
Right.
Yeah, well, an audiologist would sort of be the baseline. I think you are going to have trouble persuading the VA of a freestanding audiological processing disorder without pretty compelling evidence from a neurologist, I think, before you get to the end of the road there. That's not to say an audiologist might not be able to convince the VA, but this is a kind of condition that VA can't see, touch, smell. Anytime you get into the realm of things that the VA rater can't kind of see and touch, it's a challenge. So the better medical evidence you can put together describing what's going on, showing why it's going on, showing how it's related to your service, the better you're going to do. It's just conditions like this are challenging to prove.
I know that with hearing loss, simple hearing loss, family statements, lay statements can be very helpful in getting an accurate rating. Would the same be true in a case of
Oh yes.
Okay.
The
auditory
more
processing?
the more evidence you can demonstrate, you can provide about how this interferes with someone's functioning, the better. And who better but immediate family to provide
Sure,
that?
Sure. So for a veteran who's already rated and service connected for hearing loss, but after talking with their audiologist and then meeting with a neurologist, the picture starts to emerge that there's a likelihood of an auditory processing disorder. What would the next sort of steps be there? Just getting the best documentation possible from
Getting the
a
best
neurologist?
documentation possible and trying to sit down and sort out what additional limitations this imposes over and above whatever the hearing loss rating might be.
Okay. And I guess for somebody with just hearing loss, that then the auditory processing disorder emerges, it's probably worth looking back at their service history to see if maybe there's not a TBI at the root of it. I know a lot of veterans are shocked to discover that any loss of consciousness is technically a traumatic brain injury, even if it's a very mild one. And if there's one thing I've learned about the functioning of the human mind after all these disability cases, it's that anything is possible. There's a lot that can go wrong. And so, I had somebody get to 100% who was running to pick up the phone and slipped and smacked their head on a ladder rung in a supply closet one time. And it just snowballed.
Just snowballed.
Yeah.
Yeah, unfortunately, humans have very tough skulls, and the skull itself doesn't get damaged easily, but the brain kind of floats around inside, and with any kind of a serious blow, the brain kind of gets bounced off the other side of the inside of the skull, and it's not nice. It can do a lot of damage, and it's not immediately apparent. And one of the things that you see is these are young people, as a rule, in the military. Typically people go in their late teens, early 20s, and so they're kind of at their peak physically. So even if they sustain some damage, it may not be immediately obvious, but as they age, those things become more impairing, and you have to kind of go back and figure out what happened. But as you said, being knocked unconscious, even for a matter of seconds, likely has an impact on the brain. And one of the things about TBIs in particular is that while one blow to the head may not show any resulting damage, a second blow in the same area tends to be very serious, sometimes catastrophic, so that a person who has multiple blows to the head, which unfortunately is not all that uncommon in military service, can really develop problems, and those problems tend to worsen over time.
For a veteran who's applied for service connection for an auditory processing disorder and done all they can on the evidence side, but get scheduled for a C&P exam, what are some things they can do, things they can keep in mind going into a C&P exam with auditory processing disorder at its core?
Well, I don't think it changes. I don't think how you approach the C&P exam changes depending on the condition very much. The key is to explain to the examiner what's going on. And one of the things that it's important for veterans to understand is that C&P exams are done by contractors. So the doctor has a limited amount of time to spend on your case, whether it's in talking to you or looking at records or whatever else. They are not your treating physician. They are not going to spend a lot of time trying to figure it out. So the more you can explain fairly succinctly what's going on, the better off you're going to be. Now, theoretically, if it's an auditory processing disorder claim, the VA ought to set you up with an audiologist. They won't always, and one of the things that will be important to do is to explain, I've been tested, it's not my hearing, I have trouble processing what people say after I hear it. It's unscrambling it in the brain. And so you want to ask for an audiologist, you want to ask for a neurologist, you don't want a general practitioner if you can possibly avoid it, and you want to make that point to the VA when they schedule the exam.
All right. On that note, that's the end of our episode for today. Please be sure to like and subscribe and join us again next week.
We'll hope to see you then.
Thanks for joining us this week on the Victory Over VA podcast. Make sure to visit our website, veteransbenefits.com/podcast, where you can subscribe to the show in iTunes, Spotify, or via RSS, so you'll never miss a show. While you're at it, if you found value in this show, we'd appreciate a rating on iTunes, or if you'd simply tell a friend about the show, that would help us out too. If you like this show, you might want to check out our free consultation to see how we can help you with your denied claim. Simply go to veteransbenefits.com and fill out the form. You fought for us. Now let us fight for you. And be sure to tune in next week for our next episode.